We're back with new research that shows a growing number of pregnant women are choosing to give birth at home instead of a hospital. It's a trend that is raising some new questions about safety and access to emergency care. The most recent CDC data finds more than 50,000 women had planned home births in 2024. That's a 70% increase from just 10 years ago. As home births grow in popularity, some midwives want to see better coordination between them and hospitals. See, if complications arise during labor and a transfer is needed, the process can be delayed, and that puts potentially mom and baby both at risk. Joined now by NBC News health reporter Aria Bendix, who's been investigating this trend over the last year. Good to have you with us. So you spoke with many women who've had births at home. First, talk about what's driving more women to choose home over hospital.
Yeah, we're really seeing this cultural shift in how women want to give birth. Part of that is because of some distrust of mainstream medicine. We've seen in polls that's growing and growing. It's given rise to the Make America Healthy Again agenda and so-called MAHA moms who are pushing these unmedicated births. But then there are also women who just want a calmer, more personalized experience than a hospital can offer. So those are the people who are choosing this. There are also a subset of women who really don't have a choice. We're seeing the closure of labor and delivery units across the country, but specifically in rural areas. And so in those areas, maybe the midwife is the only option for a woman who wants to give birth.
Because there's not a hospital close enough to get to
Exactly.
if you suddenly start to go into labor. Several midwives told you, as we mentioned, if complications arise, it can be hard to schedule or coordinate that transfer to the hospital. Talk about why that is.
Yeah, I mean, that's really the crux of my reporting here. The more I talked to midwives, the more I learned about these challenges. Many said they called the hospital and either were dismissed or met with hostility. One midwife told me the charge nurse at the hospital simply told her, "We won't take walk-ins," which we know is illegal. Hospitals by law have to accept patients in emergencies. So it's a growing problem here, and there is concern that with the rise of home births, it will be more of an issue. Now, on the hospital side, there are some concerns about liability. They don't know these patients. They are not familiar with their medical history and haven't observed them over the course of pregnancy. So that's a concern for them, but there is really this bias that's sort of underlying the problem.
There's some fascinating numbers here, so I want to read some of them here, because certified midwives, many of them have master's degrees, are restricted from practicing in 38 states here in America, and those numbers are sort of make the U.S. an outlier globally. Midwives here in this country attend less than 13% of births. Other countries like the UK and the Netherlands, midwives attend more than 60% of births. Why are we seeing this big gap? What are some of the changes that would be needed to close that gap?
Yeah, so this is a problem that actually goes back a century. We saw these anti-midwife campaigns in the early 1900s, sort of stigmatizing the practice. That stigma still lingers today. Obviously, in the U.S., we also prioritize innovation, and hospitals can offer more in terms of pain relief or surgery. That's a good thing, but it also has left patients with maybe fewer options as we just move towards that model exclusively. The good news here is that there are really clear solutions to this problem. One is just to integrate midwives into the hospital system, and we're seeing that trend grow over time. Another is for hospitals to partner with birth centers. So they're essentially this middle ground center between a hospital and a home birth that patients have the option in some parts of the country to go to.
Yeah, go ahead.
And the third option is just the easy one. Hospitals, doctors, and midwives can work together and come up with these plans and communicate better.
There you go. That's all. Imagine that if we just talk things out.
Exactly.
No surprise, social media is driving a lot of this greater interest in home births. And sometimes social media is not the best place to get your medical advice. So what should people consider or know before they do make this decision?
Yeah, the most important thing is you want a midwife who is licensed and who you really trust, someone who's going to work with you to come up with that plan. If there's an emergency, where do we go and how soon do we want to leave for the hospital? You also want a midwife who's going to be honest with you about whether you're a good candidate for a home birth. If you're carrying twins, you have gestational diabetes, at risk of preeclampsia, you are probably not a good candidate, and you want a midwife who's honest about that. And just like you don't want a hospital that's antagonistic toward the midwife, you don't want a midwife that's antagonistic toward the hospital.
Good advice there. All right, Aria Bendix, thank you so much. And you can read much more of her reporting on NBCnews.com. Check it out.
We thank you for watching, and remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.